Hey everyone, my name is Yunistiandara. In this occasion, I will present about language disorder in psycholinguistics. First, definition of language disorder. Language disorder refers to impairment in the ability to understand and or use words in a context, either verbally, non-verbally, or both. According to Psychology Today 2018, language disorder is a communication disorder in which a person has persistent difficulties in learning and using various forms of language, e.g., spoken, written, and sign language. A disorder that involves the processing of linguistic information. Problems that may be experienced can involve the form of language, including grammar, morphology, syntax, and the functional aspects of language, including semantics, and pragmatics. Second is characteristics of language disorder. There are two characteristics of language disorder. The first is receptive disorder is affecting children to understand spoken and sometimes written language. Second is expressive language disorder that is affecting children to understand what others are saying, but they have a hard time to express their own ideas when they speak. Children with receptive language disorder may have some difficulties, such as difficult times understanding what others say, problems following spoken direction, difficulty organizing their thoughts. Children with expressive language disorder may have problems such as lack of words, limited vocabulary, poor sentence structure, repeating certain phrase over and over again, finding the right words when talking, inability to start or hold a conversation, have difficulties recalling or retelling information. The third is types of language disorder. There are some types of language disorder such as sensory impairments, apraxia, dyslexia, dysgraphia, stuttering, Down syndrome, autism, ADHD. Sensory impairments is the common terms used to describe deafness, blindness, visual impairment, hearing impairment, and deaf blindness. Meanwhile, apraxia can cause problems in parts of the body. It causes damage to the parts of the brain related to speaking. Dyslexia is characterized by difficulty with learning to read fluently and with accurate comprehension despite the normal of or above average intelligence. Dysgraphia is difficulty or bad in handwriting. Stuttering have a difficulty in which a sound, syllables, or words are repeated or prolonged, disrupting the normal flow of speech. Down syndrome is a genetic abnormality. This syndrome occurs because of an extra copy of chromosome 21. Autism is the neurodevelopmental disorder characterized by impairment social interaction, verbal and nonverbal communication, and by restrict and repetitive behavior. Meanwhile, ADHD is one of the most common childhood disorder and can continue through adolescence and adulthood. What are the causes of language disorder? There are some causes of language disorder. The research has been extensive and suggests some possible causes for SLI, such as genes and heredity. Research has found that 20 to 40% of children with a family history of speech and language impairment have the condition themselves, compared with about 4% of those with no family history of SLI. Prenatal nutrition. Some research has shown that when a woman takes prenatal folic acid supplements during pregnancy, her baby is less likely to have a severe language issues. Other conditions such as autism spectrum disorder, Down syndrome, intellectual disabilities, and premature birth might also cause of language disorder. In conclusion, language disorder can make it difficult for children to understand what adult people are saying to them and to express their own thoughts and feeling through speech. Language disorder can be separated into two characteristics. The first is receptive disorder and expressive disorder. Furthermore, the cause of language disorder by some factors. First, genes and heredity. Second is prenatal nutrition. And the third is other condition. I think that's enough from me. Thank you.